Tony Stein joins me now, Chief Executive of Healthcare Management Solutions, which operates 65 care homes across the UK. Tony, just before we get on to the new government plan on this, can I start just by asking you what you make of the situation in the social care sector at the moment? Are things as bad as those in the NHS seems to be suggesting they are? Good afternoon to you.
Hi, good afternoon. Hi, Ben. Yes, I mean, I've been in this sector for 20 plus years, managed hundreds and hundreds of care homes during that time, and this is perhaps probably the worst of the times that I've been through. But what I will say to you is, and I thank you very much for raising this for discussion, because this is a big debating topic and it affects, as you said, everybody in the country. And I can explain how we got here. How we've got here is a multitude of things, but principally because the NHS is now doing a job it never used to do. But, you know, because of that, the NHS is tackling long-term chronic illnesses, which it's not designed for. The social care sector is ready and willing and able to manage some of that pressure, but actually the budgets are split between health and social care, and that causes major issues. So the problem today that we have because of RSV and flu and COVID and the usual pressures in hospitals is we've got people, as you say, medically fit for discharge who are waiting to go into care homes. Local authorities are responsible for funding their stay in a care home. The local authorities are, most of them, on the brink of financial failure, you know, because of the pressures that they're under. And as a consequence of that, they don't rush to take people out of the hospital setting. So then you end up with A&Es that can't discharge into wards because wards are bed blocked. And then you end up with ambulances parked outside that can't discharge into A&E. And the whole thing just grinds to a halt when we have particular pressures, as we do now with the winter pressures. So until the issue of funding is resolved, it will never get fixed. And so what's happened, as you've seen now, is that the NHS is putting its hand in its pocket to fund the care of those people out into care homes. And so that's a sticking plaster solution to a long-term problem, but at least it's a solution. You know, we have at the moment some 40 to 50,000, it's probably a bit more than that actually, empty beds in social care, ready and waiting to take people out. It's a much, much better setting, Ben, and much safer setting for people who are medically fit for discharge than the hospital. I mean, bless her, my mum passed away in October of last year, and she spent 6 weeks in a hospital bed, and she was medically okay. She just needed to be placed in somewhere where they would help her to get back on her feet with physiotherapy and occupational therapy. And she spent 6 weeks with her mobility deteriorating and ultimately passed away. It wasn't good for her. It blocked a bed for somebody who needed acute hospital treatment. And genuinely, the whole system just grinds to a halt. And a lot of it is to do with the fact that local authorities can't afford to take people out of hospitals.
So the beds are there, Tony. The beds are there in the homes that are needed. The issue, what you're sort of spelling out, is a reluctance of local authorities to fund people to use those beds, to occupy those beds.
Yes, and the thing is, you know, it's hard to levy criticism here because, you know, how they've got into their financial problems is a mystery to me. I don't run a local authority, you know, but what we do see is that local authorities are hard pressed for cash, you know, and, you know, the current inflationary impacts are hitting them as well. You know, energy price increases, staffing cost increases, you know, all the usual good stuff. So, you know, I can't speak to why they've got the problem, but what I can say is that is the problem. There's so much unmet need out there that it's untrue. So, you know, if the government had gone ahead with the 1.25% health and social care tariff on NI, that actually would have really helped if it had been directed into the health and social care side of the business, so that the local authorities could utilise that and bring people out into social care where they needed to be.
We know funding's an issue, Tony. I want to ask you about how we treat carers themselves. Rishi Sunak was asked this morning whether he would be willing to be a carer and all the work that entails for the £18,000 a year that many of them are paid. Is a big part of the problem how we treat those that are working in the social care sector, in your view, many of whom are leaving the profession, leaving big gaps that aren't being filled?
Look, there are some serious long-term cultural and structural issues around health and social care that need to be fixed. I think we all look at the NHS as, the sacred cow, the thing that everybody wants to protect. And this is why politically the money gets thrown at the NHS, because it's politically expedient. Social care has always taken a back seat to this. And operators, I work with operators, and I've got plenty of peers who have senior positions in the sector, and all of them, what they really want to do is they want to reward carers for the job that they do, which is a highly responsible job. They just don't have the wherewithal to do it. If you're providing, particularly there's two sides to care homes. There's the private care home side, and then there's a socially funded side. The private care homes can dictate what fees they charge, and to some extent they are architects of their own futures. But if you're a taker of fees from the local authority, if the local authority says, I'm only going to pay you £700 to look after a residential care patient, then actually, you are very, very limited on what you can pay your staff. Now, it's interesting that in that conversation Laura Kuenssberg had with Rishi Sunak this morning, they had this conversation, and Rishi kept saying, it's not all about money, it's about recognition. That's true, but then what does it say to somebody about how you recognise them and how you appreciate them if all you're prepared to give them is minimum wage? That sends a very strong message, doesn't it? And operators, I will tell you now, they don't want to pay low pay to carers, because we all recognise what a difficult and responsible job it is. But our hands are very much tied by the fees that we get.
Tony, absolutely fascinating. Really great to get your insight and expertise. Thank you for your time this afternoon. That's Tony Stein, Chief Executive of Healthcare Management Solutions, which operates 65 care homes across the UK.